In the following video, we are going to learn this method. Our model will be Julia Nagibina, who is a certified practitioner at the Splitmassage studio here in Riga, Latvia. Before we start the procedure of split massage, a manual face rejuvenation, we need to check for soft facial tissue conditions. And to do this, we will need to palpate them thoroughly. In order to perform the diagnostic, we need a diagnostic checklist, which will be filled out based on a sensitivity scale from 0 to 10 that will depend on the conditions of the facial muscles, ligaments, and the fatty tissues. During diagnosis and palpation, pain will be felt in spasmed muscles and epidermis tissues. You will want to mark these sensitive areas from 0 to 10 in the diagnostic checklist, where 10 means the maximum sensitivity. The most important muscle that is responsible for the condition of our face is located in our back and is called the trapezius muscle. It originates from the occipital bone of our head. Its upper part is very commonly hypertonic. Go ahead and shape your palm like a triangle roof and place it on the upper part of the opposite shoulder. As a rule, either a left or right part of the trapezius muscle is stiffer or tighter, and it is clearly seen when the length of the shoulders is compared. Please mark this on your diagnostic checklist. Let's get acquainted with the diagnostic card. We can see the following information: date, name, age of the person to be examined. Additionally, you should state where is the right and where is the left side. A minute ago, we palpated and diagnosed the trapezius muscle on the right and the left side. In our case, our model Julia noticed that the tenderness of her trapezius muscle is felt stronger on her right, and she evaluated it as 9 points out of 10. And 7 out of 10 on her left. Let's move on to the diagnosis of the sternocleidomastoid muscle that plays a direct effect on the shape of our face. On its both sides, it's attached to the bone. On the upper side, it's attached at the mastoid process of the temporal bone of the skull, but the lower attachment is found at the manubrium of the sternum and the clavicle. When we have our shoulders bent forward or head hunched down for a long period of time, the sternocleidomastoid muscle is in its shortened state. When we straighten out, the muscle takes up its normal position, the tension goes away from the attachments, and the muscle is returned to its anatomical length. But what will happen if the muscle is in its shortened state for a long period of time? Then we can get to this picture where, due to spasms and chronic shortening of the muscle, we have edema forming and fibrotic tissue developing around the muscle due to the lymphatic flow stasis. And because of that, we are not able to see the lines of the muscle anymore. The muscle is hidden deep in the tissues. It becomes thinner and shortened. So let's take a look at how we can diagnose the condition of the sternocleidomastoid muscle on ourselves. To find the muscle, first turn the head to one side and then to the other. Locate the muscle's boundary from the upper insertion to the lower. If the upper attachment of the muscle is not well visible, that indicates that there is trophic tissue changes in the muscle. Now, return the head to the upright position and slightly bend it. Palpate the muscle from the upper insertion behind the ear down to the lower part of the collarbone. Compare the thickness of muscles on both sides of the neck. Possibly the muscle is stiffer and more painful on one of the sides. Indurations or stiffness in the sternocleidomastoid muscle will affect the lymph drainage of the facial tissues, cause the double chin to form, and will affect the facial contours. We want to make sure we mark all of this in our diagnostic checklist. On our diagnostic checklist, we want to mark the state and the condition of the sternocleidomastoid muscles. During palpation, our model felt that on the right side, closer to the attachment of the sternocleidomastoid muscle, she felt stiffness and certain formations within the tissues. As well as on the opposite side, on the left, her sternocleidomastoid muscle, in the lower part of the belly, she also felt some thickening. These are the places of increased tone in the muscle, and these places need relaxation and stretching. Now we will check the tissues of the double chin area. We will start in the central part in the area where we have the submental lymph node, and typically it is noted the formation of edematous and fibrotic tissue there. And we need to palpate these tissues in order to figure out which state they are currently in. Let's turn to our model. In order to do this, we will have to grab with both of our fingers and hands the tissues under the chin. As we grab them, we want to lift them up and try to feel with our fingertips what's inside. You might feel small nodules or some tissue thickening. As we move down from the chin going down the neck, we might feel that at the bend of the neck is the most sensitive area. You might feel more fibrotic tissue here. And as we keep moving down the neckline, we might feel that the tissue is not homogeneous. And we might feel that the tissue is much thinner in the areas where we fold lines and is much more plump in the areas that do not have the folds. In this way, you want to palpate the thickness of the skin, how painful it is to the touch, if it's edematous or its unevenness, and go ahead and mark these findings in your diagnostic checklist. And we're marking a 3 out of 10 on the painful scale, but we also want to note that there is changes in the volume of the tissue when we went down the neck. And now we will move on to the diagnostic of our submental area. We have already palpated our tissues under the chin. And we will palpate from the center of the chin towards the jaw edge on one side and then on the other. Somewhere in the area of the submental lymph node, we typically can observe changes in the tissue. Why does that happen? Right next to there is a sternocleidomastoid muscle that typically is within increased tension, especially for right-handed people on the right and left-handed on the left. And because of increased tension, the tissue loses its nutrients and we have fibrotic tissue growing in that area. Additionally, right above that is the end of the masseter muscle. Its edge is located right there, and this muscle is also in increased tension and can worsen the blood circulation in that area. So now we will actually test going from the center towards the end of the jaw, which part of the tissue is more sensitive. Where we have the fibrotic tissue, and we will do that on both sides, the left and the right, and see which one is stronger. Let's start the palpation. We will move from the center of the chin right under the area and towards the ear. You want to make sure that you palpate very thoroughly. Try to lift the tissue from the bone and feel it between your fingers. And make sure you note which part of the tissue has changed, is there fibrotic tissue changes, and how difficult it is to move the tissue forward. And it looks like we can't as easily move to the end of the jaw towards the location of the sternocleidomastoid muscle attachment. On our diagnostic checklist, we want to note the information that we have found. We diagnosed that when we were palpating the tissues on the right side, it was about a 7 and closer to the middle of the jaw. But when we felt the tissue on the left side, the changes started a little bit further and their sensitivity was much less. It was 6 out of 10. This might be related to the fact that the sternocleidomastoid muscle on the right side is more in a spastic position. And this might be one of the reasons why the fibrotic tissue formation and the sensitivity starts much closer to the center on the right side. And now we will check the condition of the masseter muscles. On the lateral parts of our face, we have our masseter, which is one of the strongest muscles in our face. And this muscle is divided in two. One is diagonally located and is superficial. The second one is vertically located and is much deeper. The diagonally located masseter has its ligament right under the edge of the zygoma, and also its rigid attachment at the edge of the jaw. Considering that the masseter is always in a tensed position due to the fact that we use it to talk, to chew, or our psychosomatic state, we start to form hollowing areas right in front of it. And we can visually see it on this picture to the left, where towards the back of the face we have the masseter muscle, and then towards the front we have the hollowing area that's present. And right on the edge of this hollowing, we start to form a subcutaneous fat roll. This is why we need to palpate the edge of the masseter on one side, find the hollowing located around that area, and also right above that we need to find that subcutaneous fat roll that is caused by the shift in the tissues due to the increased muscle tension. Let's palpate this on both sides and note it in our diagnostic checklist. Go ahead and place your fingers right on the edge of the chin, and we will move along the jawline towards the edge of the face. We need to locate the edges of the masseter muscle. And it looks like Julia has found the borders because when she clenches her teeth, she feels the muscle movement. And from this area on, in the upper layers of the tissue, we need to locate the subcutaneous roll, which typically will be very sensitive and will go up towards the zygoma. This is the subcutaneous fat roll that will form from our intense use of the masseter muscle. We need to palpate this roll on one side as well as the other. And go ahead and note the sensitivity level on your diagnostic checklist. Let's put down our findings in the diagnostic checklist. We have found that the attachment of the lower part of the masseter is located closer to the central part of the face. This could be related to the muscle tone of the masseter as well as the sternocleidomastoid muscle. This is why the subcutaneous fat pad roll that we have found was located closer to the central part as well, and is more sensitive. The same subcutaneous fat tissue roll that was found on the left side is located further and is less sensitive, where it's 6 out of 10. Now we will palpate the state of the muscle that lowers the corners of the mouth, the depressor anguli oris. It has one attachment at the corner of the mouth, and then the other attachment is at the lower part of the jaw. In order to diagnose the state of the muscle and see which one is more tensed, we can look in the mirror and see which mouth corner is lowered. It can be lower than the other, or the wrinkle in this area can be deeper or have a bigger shadow. But you may also find that the corners of the mouth are both on the same level. And in all of those cases, we will grab the muscle and pull it up with our fingers, palpate it from the corner of the mouth down to its end. Our model, Julia, has looked at herself in a mirror and has noted that on the left part of her face, the shadow is longer and more pronounced. Right in the area of this fold, she is going to lift the tissues with the purpose to feel the muscle. She will try to feel the attachment point right under the corner of the mouth and go down to the lower attachment. She will perform the same technique on the other side, and she will note if there's a difference in the sensitivity and the length. The more tensed muscle is shorter and more dense, especially by the attachment points under the corners of the mouth. The muscle that's within the normal tone is much easier to grab with her fingers. It's easy to massage and palpate. It's much longer in length, and it is much easier to palpate in the area of the attachment. The way to mark this on a diagnostic checklist is to use an arrow by the corner of the mouth that was lower, because when we will be performing the massage, we will start to palpate the depressor anguli oris in the area where it is more tensed, in our case on the left. Let's now check the mandibular cutaneous ligament. The mandibular cutaneous ligament is located on the jaw and pulls the tissues close to the jawbone, typically on the side or the corner of the mouth where the depressor anguli oris is more tensed. The tissues on this side will have more fibrosis in the area of the ligament. This is due to the fact that the attachment of the ligament can start growing and is located at the attachment of the depressor anguli oris muscle. And in this situation, where we have the muscle hard attachment as well as the ligament attachment in that area, we start to form this type of dip and fibrosis around the tensed muscle. Let's test the mandibular ligament on the left and on the right. Let's try to lift our tissues in the mandibular area around the depressor anguli oris and the attachment of the ligament. Try to feel how easy it is to pull away the tissues from the attachment of the ligament, and attempt this on one and the other side as well. Now we have palpated the mandibular ligament on both sides, and we have found that on the left side, where the corner of the mouth was pulled lower, the mandibular ligament on this side also pulls the tissues much stronger towards the bone, which causes decreased blood flow circulation in this area and causes uneven jawline. Around the corners of the mouth, we have a very important structure called malleolus. This is a chiasma where the facial muscles of the mid-face and the lower face intersect in this area. And all the tension that any of these muscles will experience will be felt in the malleolus. The tissue of the malleolus will tend to thicken, the corners of the mouth will be more pronounced, and we start to form wrinkles at the edge of the formation where the malleolus is, between the buccal muscle and the orbicularis oris. In order to check what the status of our malleolus is, we want to palpate it on both sides, the left and the right. And let's note on what side the tissues of the malleolus are thicker, more sensitive, and take up a bigger part of tissue that seems to be tensed. Once we have palpated, we can note that on the left side for us, the tissues of the malleolus were more sensitive, more firm, and take up a bigger part. And we will note this information with a little X at the spot where we felt this. In this area of our face, we have the buccal muscle as well as the cheek fat pad. The state of our tissues in this area will directly influence the formation of loose jowls. Due to the tension in the masseter muscle as well as when we smile, will cause the tissues above this muscle to thin out. As it thins out, it will also form areas of firmer tissue that will pull the tissues down and form jowls. That's why right now we will palpate the soft tissues in this area during our smile and when we don't smile as well. We will ask our model to smile, and she will grab her superficial fat tissues in the areas of the smile. She will try to feel if there's a difference between the thickness of the tissue and the sensitivity from one side to another. Then, as she's done palpating, she will stop to smile and she will try to feel deeper within the tissues of her cheeks and try to palpate if there are any changes in the deeper fat tissue layers. We know that our face has superficial and deep fat tissues, and we know that changes can happen on the superficial as well as on the deeper level. What can Julia find in her tissues? She might find some sensitive formations. She might find fibrotic formations that may feel like little beads, and we need to be able to feel this and to note it in our diagnostic card. Let's put this information into our diagnostic card. Our model has noted that on the right side, she had pain about a 3 out of 10. And on the left side, she noted that there was no sensitivity, the tissues were soft and easy to palpate. Now we will focus on the mentalis muscle and the formation of the lower lip line. In the center, right below the lip, we have the attachment of the mentalis muscle. The actual muscle is split into 2 bellies and is located in the center. Typically, the mentalis muscle is very tensed, and this tension is visible at the attachment, which is the beginning of the formation of that under a lip fold. We will palpate what the sensitivity is like in the central part, then we will palpate across the whole fold, which will lead us to the crossroads between the depressor labii inferioris and the depressor anguli oris muscles. And we will try to feel if the tissues in this area are sensitive and how soft they are. Let's check out the state of our mentalis muscle. Do we have any sensitivity or pain? Then we move further across the line of the fold and the crossroads between the 2 muscles that pull our mouth down. And we want to make sure we note if there are any thickenings in the tissue and sensitivity. Once we have palpated the state of our mentalis muscle and the state of our underlip line, we have found the following. In the center of the mentalis muscle attachment, there is some tissue thickening. The sensitivity is about a 1 out of 10. But if we continue going down further the fold, to the right and to the left, we have found that there are crossroads of 2 more muscles in that area. And at the crossroad of the depressor labii inferioris muscle, we felt that there was increased tension in that area. And to note that information, we have measured the sensitivity about a 3 out of 10, and we'll write that down. Now we will move on to looking at our orbicularis oris muscle. You can visually see the borders of the orbicularis oris muscle by the formation of the nasolabial folds. A lot of muscles, especially from the central side and the lower part of the face, do get attached into the orbicularis oris muscle. The incisor muscles are also located in this region. We can see them under number 15 and 19. These areas will form sensitive formations, which will decrease the blood flow to the upper lip. Together, we will test what the state of our orbicularis oris muscle is. We will palpate the tissue along the vermilion border to see if they form any wrinkles above the vermilion border and to see if there's any depletion in the tissues, and along the nasolabial folds to see if the incisor muscles have any change to them. So let's check the state of our orbicularis oris muscle. First, we will check the tissues along the vermilion border. Are there any changes, sensitivity, changes in the fat distribution? Then we move up a little bit higher and we feel for the same thing. Are there any changes in the tissue and the fat distribution? And then we move on to the nasolabial fold. And we want to palpate on both sides what is the thickness of the tissue. Once we have finished our palpation of the orbicularis oris muscle, we have found that on the left nasolabial fold, we have found a painful or sensitive formation along the line that we will mark with a 1 out of 10. Now we will move on to the zygomaticus major muscle. If we look in the mirror, we want to check out which side the muscle is shorter. In order to see this, we will smile and we will see on which side the smile is shorter. From the upper to the corner of the mouth, which length is shorter. Then we will move on to palpating deeply the zygomaticus major muscle in the area where it crosses the tear through. As a rule, if on the face you can find the formation of bags under the eyes or soofs, that means that where the under eye ligaments cross with the zygomaticus major muscle, there is some sort of formation that will hold tension. Additionally, when we palpate the zygomaticus major muscle, we can find some tension between the crossroads of that muscle and the levator labiae superioris. This will show a direct relationship in the formation of the overhanging fold. In order to diagnose the zygomaticus major muscle, we need to smile and find the length of the smile from the attachments of the muscle on one and the other side. You will find that on one of the sides the length will be shorter. In Julia's case, it's on the right side. That means that on the right side the zygomaticus major is more tensed. And we will start to palpate on the side of the muscle that is more tensed. In order to know that you're located exactly in the muscle, we need to check ourselves. And in order to do that, we can smile. And we will be able to feel if we have the muscle between our fingers or not. And once we go along the whole muscle, we need to pay close attention at the crossroads of the muscle, levator labiae superioris and the zygomaticus major, and the zygomatic ligament. Because as a rule, typically at these crossroads, we will have tension and formations and spasms. In the following way, we can mark our findings on the diagnostic checklist. That on the right side, our muscle is more tensed and the smile is shorter. You can mark that with 2 backwards arrows. Also at the crossroad of the zygomaticus major and the levator labiae superioris, we palpated a sensitive spot that we can mark on the sensitivity scale a 2 out of 10. On the left side, when we palpated the muscle, we have found that the sensitivity and tension was higher up at the crossroads of the zygomatic ligament and the muscle. And we have marked it and evaluated the sensitivity on a scale a 2 out of 10. Now let's diagnose the state of the zygomaticus minor muscle. The zygomaticus minor muscle is attached to the zygoma by the infraorbital foramen and crosses its path with the zygomatic cutaneous ligament. And as a rule, the muscle typically is more tensed on one side. And at the attachment of the zygomaticus minor muscle, we start to see the formation of fibrotic tissue and decreased circulation. In order to understand on what side is the zygomatic minor muscle is more tense, we can examine this by looking in the mirror. So in order to examine on which side the muscle is more tensed, we will slightly bend our head forward and mark on which side do we note the lowest hollowing under the eye. This area where the zygomaticus minor attaches, and we want to assess the state of the muscle where it crosses with the zygomatic cutaneous ligament. And as we previously said, this is the attachment spot of the zygomaticus minor and the crossroad of the zygomatic cutaneous ligament, which can cause increased tension in this area and cause fibrotic formations. Let's mark our findings. On the left side where the zygomatic minor muscle and the zygomatic ligament cross, we found that tissues had increased tension, which we can mark a 2 or 3 out of 10 for the sensitivity that we felt. Let's review. We know that the subcutaneous fat pads are located deep as well as subcutaneously. And we now will want to look at the condition of these fat pads over the muscles that we just tested to see if there is any edema or sensitivity in the tissues. First, we want to palpate superficially our tissues. In order to do that, we just need to grab superficial tissue between our fingers and palpate it. That doesn't mean you have to go deep. We just want to stay in the subcutaneous adipose tissue, because it's important to remember that conditions can be in the subcutaneous as well as in the deep layers. We will palpate the mid-face area, the sides of the face, and then you want to make sure you go into the deeper layers. And to compare, is the sensitivity bigger in the subcutaneous or the deeper tissues? And now, since we have palpated the subcutaneous fat tissues as well as the deeper fat tissues, we can finalize and say that the sensitivity was more on the subcutaneous layer, about a 5. And now let's move on to assessing a visual of our tear-through and orbicularis rotating ligament. Anatomically, in this area we have our orbicularis ligaments, which have a function of holding down the subcutaneous fat tissues there. And with age, these ligaments tend to thicken and form fibrotic tissue, which will cause a decrease in lymph flow and outgo from this area. And if we have decreased lymphatic drainage, we will start to see a formation of under-eye bags and possible hernias. But also, decreased blood flow can cause fibrotic tissue formation in the area of the orbicular retaining ligaments and also in the area of the upper attachment of the muscles. And we can visually assess how strong the attachments are, how thick they are, and how strong they're pulling the attachments towards the bone. Now we will look at the nasalis muscle that raises the upper lip and opens up the nostrils. As a rule, if this muscle is tense, the nostril on that side is more open, and on that side of the nose you can see the formation of edematous tissue. So now our model Julia is going to palpate both sides of her nose, and she assesses that on the left side the tissue is thicker than on the right side. But also visually she assesses that the nose is more open on the left side and there is a bigger hump over the area of the muscle. On our diagnostic checklist, we will mark with an X the area of the nasalis muscle that we have assessed and found to have more dense in the tissue, even though the tissues did not feel sensitive. Next, we will look at the corrugator supercilii muscle. This muscle has its hard attachment at the bone, and it tends to form wrinkles at its hard attachment when seen on the skin. Also, on the side where the muscle is more tensed, we see a bigger formation of tissue and edema, as well as decreased blood flow. When you're diagnosing this muscle and visually you do not have any wrinkles, you can slightly frown. And to diagnose, over which eyebrow do you form a bigger hump of tissue? In our case, on the left side, we see a bigger tissue formation when we try to use our corrugator supercilii muscle. Then we want to palpate the soft tissues with our fingers deeply by grabbing the muscle. And by feeling, we also confirm that on the left side we feel thicker tissue, which means that the muscle on the left side is within increased tension. And we'll mark accordingly in our diagnostic card. As we mark in our diagnostic card, we mark with an X, and on the left side we have marked a 3 out of 10 to sensitivity and a 2 out of 10 on the right side. Next, we want to look at our frontalis muscle. Typically, this muscle has more tension on one side of the muscle. We can even see this on a relaxed face when one edge of the brow is more raised than the other. But if we don't see that visually on a relaxed face, we can try to raise our eyebrows and to look which eyebrow goes higher and tends to form deeper wrinkles and more of them over that eyebrow. So, looking at the model, we want to check if there is a difference between eyebrows or their height. It's hard to tell on our model. And then we ask our model to raise her eyebrows, and we see that the left eyebrow raises quicker and we even see wrinkles right above that eyebrow. And even though the difference might not be as big, but we can definitely tell that the left side of the muscle is more tensed. Right above the frontalis muscle, we have the epicranial aponeurosis. And it's very often that the aponeurosis can have some edema, or the tissues can have a lack of hydration. We want to visually look and see if there are any wrinkles in this area, and how deep they are. On both sides of our forehead, we have the frontal eminences. Tissues in this area tend to stick close to the bone. We want to palpate the state of the tissues in these areas, and how strongly are they attached to these muscles. And over the eminences, we want to push the tissues together and rub them. If it is easy to lift the tissues and they don't give us any sensitivity, it means they are in a healthy state. If we feel pain or sensitivity and they're difficult and hard attachment to the bone, we want to note that in our diagnostic card. During our assessment of the tissues, over the frontal eminences, we note that on the left side the sensitivity was about a 2 out of 10, and on the right side it was a 1 out of 10. And now we have fully completed our diagnostic checklist, based on which we will perform our massage session. After about 3 to 4 sessions of massage, it's important to do one more diagnostic card like this, and to see if there's any positive dynamic changes. Did all the sensitive spots diminish? And did this visually improve our client's face?